And so that's how we met and came together and said, wait a second, actually, we work, we think we can work really well together. And that's how we met and came together. This is probably 4.5 years ago now.
Yeah, that's an awesome transition and a great story that leads one into the next about how you kind of progress through your own career.
Yeah.
I think that thesis is very interesting, though. The bigger access, greater TAM markets have more penetration, right? When you have a need, right, more people are willing to pay for cash in order to get that direct to consumer
Yeah.
market. With that angle, though, there are a couple of things that I think you need to solve on, right? One, you don't have a doctor telling you have the condition, so you need to know that you have it.
Yep.
You know that you need to treat it, and then also you need to figure out how can I find the right doctor who also knows how to treat this and give them the regimen to treat it.
Yeah.
So being an operations specific person, how do you close these gaps and how do you think about market development for this particular problem?
Yeah. So when we started at that time, we called it something else, and we used the brand name Peak for a while. That was just because we didn't
Yeah.
know, we hadn't really formulated a whole kind of like brand identity yet. We kind of knew the structure of what we needed to build. We knew that we had to do some lab testing. We knew that there had to be physicians that would see our patients, to your point, because they're the ones that have to, just like no different than going into a bricks and mortar clinic, right? And so we said, okay, well, we have to go build our own physician network. That was something I think really core to what we did. A lot of the direct consumer companies, when they started, would use companies like Wheel or SteadyMD. Because we are providing specialty care, we just felt really strongly that we had to go out to, and to your point, to find physicians that just had that specialty. And we had to learn about those types of physicians, right? And so we had to learn, like, hey, who are the ones who knows about that patient population? Where do they come from, right? People think about, well, the urologists or endocrinologists, and certainly there are some, but what we found is they kind of span across many different disciplines in medicine, many different specialties,
Yeah.
and everybody comes from a different place. Like you might find a physician who's a family practice physician that says, I know this population because I just happened to raise my hand when we started having men with low testosterone come in. I didn't know about it. I educated myself. I started treating them. I learned more. And then a couple of years later, great, I'm kind of like the de facto expert in my practice, right? Or some physicians would say, hey, they work in emergency medicine, but they say, hey, I actually had low testosterone as a patient. And so I
Yeah.
knew that. So everybody came at it from a different angle. And so that was a really important, I would say, decision we made early on that I think is still paying dividends today.